Russia said that it became the first country to approve a coronavirus vaccine for use in tens of thousands of citizens there, despite some skepticism that it might be moving before some of the safety barriers that we have here in terms of phase 3 trials, and really testing what that vaccine might do in a population that we're watching play out here in the US, but Russia moving full steam ahead there. And so for more on that, as a lot of questions are being raised right now about whether or not that's actually safe to move ahead with those, joining us is Dr. Alison Haddock, emergency medicine physician and assistant professor of emergency medicine at Baylor University. And Dr. Haddock, good to talk with you again. I guess, this is one of those things where we have rules here in the US and other countries as well have rules for a reason, because we want these to be rolled out safely. What's your take right now, what we're seeing there in terms of the timeline in Russia and Putin saying that this is a safe vaccine and even his daughter has taken it? What's your take on that front?
Well, Zach, it's exactly like you said. It's those phase 3 trials that are missing that are an important part of the vaccine testing process. So these vaccines have been through some basic safety testing and no major red flags have been raised, but they haven't been tested in a widespread population. And sometimes you really need those more widespread tests to find safety events that are rare, but still important. And it's also needed to know if the vaccine works, if there's good efficacy. Because there's no point in rolling out a vaccine widely without evidence that it works. And we don't fully have that yet on the vaccine they're using in Russia.
Yeah, that data is not there, or at least, as you said, we haven't seen it yet. But back here in the US, obviously, those phase 3 trials are moving forward here with the big biotech names working on those. And Dr. Fauci gave the update that even if those do progress to hit the efficacy you're talking about, the timeline to get those out to most normal Americans, not frontline workers or the elderly, they might actually not be able to get it until late into 2021 next year. And when you think about the timeline for all that too, I mean, what does that say about how much time we'll actually have to see pass here before normal Americans do get the protections that we're hoping for with the vaccine?
I mean, making sure that you have safe and effective vaccines to roll out is a time-consuming process. And I would say that if you're an individual who is exceptionally eager to get a vaccine, a lot of these phase 3 trials are open to the public. So it's worth looking into if you might be a candidate to participate in one of the vaccine trials. But the good news is that when those vaccines do come out, we'll have a lot of data, a lot of evidence to show that they are safe and effective. So hopefully that'll help break down the barriers that some folks have and there's some reluctance to adopt the vaccines and really get vaccinated.
Yeah, let's talk about those barriers too, because obviously it's a function of a bunch of different things that we've been discussing here on the show. It's a factor of how quickly we can get those vaccines out to the population. Before we know that, it's going to be a factor of how effective they actually are. The FDA has set that 50% threshold of seeing kind of that response that you'd want to see in the people getting the vaccine. We know from the flu vaccine that even in the best years, it's about 60%. So that would be kind of the threshold to meet there. And then there's this other surge factor here that I'd like to discuss that really isn't talked about a lot. And that would be how many Americans might actually come out and say, you know what, I don't even want the vaccine if it's ready and the FDA says it's good for me. Right. A new Gallup poll there showed that about a third of Americans would be unwilling to actually get a COVID-19 vaccine. So how does that factor play into how we might actually be able to get out of this, or how our prospects might actually look worse if people don't actually want to get it?
Well, I really think that that's another reason why doing the vaccinations like they are in Russia without appropriate safety trials is dangerous. Because if we find out in Russia that some people are experiencing side effects, but we don't have well-gathered data on how many people and how likely those side effects are, then that might make people even more reluctant in other parts of the world, including here, to adopt the vaccine because they're seeing some bad side effects and we can't appropriately quantify them and weigh them against the benefits of the vaccine. So I think that's all the more reason why we do need to proceed in a scientific fashion and gather as much data as we can.
Yeah, that's a very good point, and one that I didn't actually think about when we think, what could happen here as we move forward. But when we think about how this has affected states differently, obviously Texas has been in a lot of people's focus here as we've seen case counts come down. Things seem to be progressing in the right direction in some of those states we've been watching, not just Texas, but Florida, Arizona, and California as well. Mm-hmm. When you see things out there on the front lines, what are you seeing in terms of citizens in that state really starting to grapple and understand how serious the pandemic is?
I think we're really seeing some improvement. The number of people wearing masks has definitely gone up in my area in Houston since we last talked. Our ICU capacity is doing better, but we're still above a threshold for concern in terms of ICU capacity. 36% of our ICUs are now full with COVID patients, and 15% was going to be our marker for being concerned that was too much of our ICU capacity taken up with COVID patients. And we're also seeing uneven progress across Texas. Texas is a really big state, and a lot of the counties near the border are still very hard hit with COVID and aren't seeing the improvements that they need to be seeing yet.
Yeah, and on that front, I mean, we've been having this discussion here, obviously in New York, as we've moved along in this state's battle with coronavirus. We've seen the positivity rate come down, case counts come down, deaths come down. Things have moved in the right direction, as I said, on cases, but Florida hit another death high there. And when you think about the lag time between cases and positive cases and deaths, I mean, that's something that we've seen pretty consistent across state lines here. So when we think about cases coming down, obviously there's still a risk. That risk is still here in New York that we could see a resurgence eventually. What does that say about how much more needs to be done in keeping some of these things that we've seen work in place and that citizens don't take their foot off the gas?
Yeah, I think that the deaths may not have peaked yet in Florida. We still need to kind of wait and see where those numbers go. But like you said, the deaths will follow the cases, and there's usually a lag there. I think it's just evidence that we need to be alert to when we see other metrics other than deaths going up, that deaths are going to follow and we need to take action. And we need to be especially cautious as most of the country starts to go back inside as summer ends and maybe schools start back up again, because this is going to be a dangerous time period for us where we could potentially start to see another surge.
I wanted to ask you about that too. On the schooling front, that does seem to be something that obviously a lot of parents who watch the show have been asking a lot of questions about that. Most school districts, seemingly anyone outside of New York City dealing with this, has erred on the side of caution and had looked into more remote schooling or maybe even alternating classroom structures. And on that front, I mean, it seems like it's going to be left to a lot of local officials. What in your mind might make that a little bit more risky than something else that we've seen where state level governors come in here and make rules? What do you think could play out if it's all left to localities?
I think there's a lot of tough decisions that families are having to make. There's a lot of tough decision that localities are having to make. I think we all saw that example of the school in Georgia where we saw the picture of very few students with their masks on and then subsequently positive COVID cases and the school had to close. And I think that might be one of the toughest things that we're going to see we're going to see opening and then closing and then reopening and then reclosing. And that's really going to kind of wreak havoc for families that are trying to set up a stable system where they can work and their kids can learn and everyone can succeed. And so we just really need to control the virus in the community to try and prevent this from happening.
Yeah, whatever can be done until we get there, as you know, we're just about a month away from all that in terms of schools mostly reopening here, but appreciate the update there from Texas, Dr. Alison Haddock, emergency medicine physician and assistant professor of emergency medicine at Baylor University. I know you're busy, so thank you again for taking the time.
Thanks for having me.